Hi everyone, Dr. Ray Benedetto here, joining you again with another quick video. Again, I hope you're all enjoying these, and today's video will be a nice follow-up to the last video I did, which got some good comments and some good conversation going, so I'm glad. That's why I do these, is to at least get people thinking and talking about their health and what they can do to help improve it. So today what we're going to be talking about is a piggyback to the flu vaccine, which is Tamiflu, right? Lots of Tamiflu nowadays. So let's just dive right in. Again, if anybody has any questions or anything, please post them below. And let's go for it. This will be I like to try and keep these short and quick, but informative. So if you have any questions, let me know. Tamiflu, right? So most of you are familiar with Tamiflu. It's a prescription medication that was approved by the FDA, and it's designed mostly for prevention, but also in the treatment of after you've been diagnosed with the flu, you're given Tamiflu, and what it's supposed to do is help prevent the flu virus from replicating and from invading other cells. So it's supposed to help slow down or stop the progression or shorten the duration of the flu. It was the pharmaceutical company that developed it is Roche, or otherwise known as Hoffmann-La Roche. It was approved in 1999, so it's been around for a while. This is not a new medication. I'll tell you what, it was initially, the FDA Committee of Medical Advisors initially declined to approve Tamiflu due to the lack of convincing data. And we'll get to that in a sec as far as then why it was approved. But basically, there's some issues with Tamiflu, right? As far as its effectiveness and its side effects. Again, the FDA administrators, the medical committee had initially, the expert committees had originally denied it. In 1999, FDA administrators overruled that committee's suggestions. You can probably imagine why. I don't have to state that. But then in October of '99, when it was approved, the FDA hedged its bet a little bit and required the drug maker to issue a statement, right? Following statement. Tamiflu has not been proven to have a positive impact on the potential consequences, such as hospitalizations, mortality, or economic impact of seasonal avian or pandemic influenza. Okay? So it wasn't approved, then it miraculously was approved, but they had to issue a statement saying that it has not been shown to have any positive impact. Right? Then why are we taking it? Or why is it approved, right? I know, it's crazy. So, overall, and this is interesting too, right? Some facts. It appears that the studies that support the efficacy of Tamiflu have been funded or are funded by the pharmaceutical companies, right? They're the ones who are going to profit from the sales. We're obviously always talking out of both sides of their mouth when it comes to pharmaceuticals. One of the main studies, so including the 1999 JAMA study, there was also a 2001 JAMA study, and a study from 1999 in the New England Journal of Medicine, the one that's often cited as far as justifying the effectiveness of this. The head doctor, the lead doctor, Doctors Hayden, Atmar, and Gravenstein, actually served as paid consultants to Hoffmann-La Roche. So not a terrible surprise that the studies that are funded by these pharmaceutical companies and the people who are doing these studies and publishing these studies and who are approving these drugs are all either consultants or have worked for or serve on the board of these pharmaceutical companies. So again, always take a lot of this information with a grain of salt and do your own homework, do your own digging on some of this stuff. Now, is it safe, right? So it's like, okay, well, if it's not all that effective, what if I take it and is it still going to hurt me? Is it safe, right? 2007 study in Japan, right? Received 1,377 reports of adverse reactions. Most of them were neurological, convulsions, encephalitis, delirium, 88 deaths reported, you name it. Same thing in the United Kingdom, right? So the United Kingdom, studies from the UK, which is the National Institute of Health and Clinical Excellence, which is like the FDA in England. Same thing, recommends against Tamiflu as a preventative strategy. Yet, obviously, the CDC and the FDA continue to push Tamiflu in spite of documented side effects, hallucinations, you name it. I mean, you can look this stuff up. These are the side effects from the medication. And we all know the stories, right? We've heard all the stories of children who are given this medication and either get terrible reactions or die. There's stories this time of year, not as much anymore, but over the last couple of months, almost weekly, of a child who took Tamiflu and was adversely affected. Again, kind of exactly what I said on my last video. Don't bother with the shots and the Tamiflus and stuff. Strengthen your immune system. Like I said, there's many things you can do. There's just not a ton of great evidence out there that these things are terribly effective, and they have side effects to shorten the flu by maybe a day or two. Strengthen your immune system. If you do get the flu, most of us can ride it out, right? Hydrate, and things like that. Get your rest. But just educate yourself. Look into these things without just blindly taking medications that your doctors give you. Do your research, do your homework on this stuff, and see if it's something that you want to put in your body. I thought this was a perfect follow-up to our last video on the flu shot, because this is kind of things that you're given after the fact. So do your homework out there. Hopefully, by doing these videos, helps you to take control of your own health and to look into some of these things. So that's it for today. If you want, there's always references I have on this stuff that's available if anybody wants any. Just go ahead and comment below if you have any questions or concerns. Give this a thumbs up if you like it. We're always looking for likes and shares, obviously. If this information is helpful to you, that's why we put it out there. Share it with your friends and your family, and give it a like if you found it beneficial. So hope everyone enjoyed this video today, and should have another short one coming up later in the week. And everyone have a great day.